on AIDS. And I was absolutely astonished to find that the population of Africa south of Sahara has doubled during the AIDS epidemic. That's totally contrary to everything I'd learnt. Then a doctor said to me, do you know they diagnose AIDS differently in Africa from how they do it in the United States? And I was shocked. I mean, you can't diagnose a disease differently and give it the same name. And they said, well, it's easy to discover it. Go to the World Health Organization, and they've put it on their website, how to diagnose AIDS in Africa. Well, I know Times journalists, many leading journalists, and I asked them, and they said, no, rubbish, no. They can't do it differently in Africa. Well, they do. They've got up on their website, anyone can go to the World Health Organization website and look up what's called a diagnostic definition of AIDS for Africa. It's called the Bangui definition. And it says that Africans have to score 12 points and need not be proved HIV positive. If they've got diarrhea for a month, that counts as 4 points. Impure water supplies. If consequent to having diarrhea for a month, they've got 10% weight loss, 4 points. Intermittent fever, 4 points. Dermatitis, a skin rash, 3 points. Okay, here's an African. 60% of the Africans live in such poverty south of Sahara that they do not have pure water supplies. That would give them diarrhea, that would give them weight loss, that would give them dermatitis, that would give them intermittent fevers. But this is down, it's on the South African diagnostic documents given to their doctors, same documents given out in Kenya, same documents given out in Uganda. It's all set out, tick, tick, tick the boxes, score 12 points, this African has got AIDS. You then tell them, a young man, young woman, and you say, you have got a sexually transmitted, which often means lots of guilt, disease, and you're surely going to die unless you can persuade your government to purchase very expensive American drugs. Most of these drugs are making $1 billion a year for American companies. It's just inconsequential. We've got a different diagnosis for Africa. It's stupid. But then if you go to the Centers of Disease Control in Washington and look up the rules for diagnosis of AIDS, it also lists ways of diagnosing AIDS in the HIV negative. There's about 12 different ways of being found to have AIDS in the United States without being HIV positive. And at the same time, they say HIV is necessary for AIDS. I do not understand my own profession. I don't understand why my fellow journalists do not go to the World Health Organization to find out how to diagnose AIDS in Africa. It's simply presumed and logical. They think they do it the same as they do it in the United States. But you know, it was politically necessary in a way because for viruses are gender neutral in who they infect men and women likewise. So if it wasn't for Africa, we'd have to say that AIDS is a male disease because AIDS is nearly totally striking down men and not women. They conceal this by giving figures in percentages, but when you get the actual statistics, I'm from the UK, last year's government figures, 47 women and 5,000 men. Also in Africa, the World Health Organization, to save money, extrapolates from the figures that they done at at the clinic. We know from the manufacturers of the HIV test that pregnancy is a risk factor for testing positive. So they take the figures from the pregnancy clinics in South Africa and they multiply them up to make a figure for the entire country. And yet, currently, the South African government lists AIDS right down below about 5 or 6 other diseases as a killer in Africa. This has outraged the AIDS lobby. And now claiming all the people dying of TB are dying of AIDS in order to be able to say that and TB is a big killer. So they're fixing the figures. I went to the stage I stayed with other journalists in Johannesburg. I had the Times correspondent antiretroviral drugs, and we come out to give them to Africans. And I thought, well, what do I say? I don't want to start a big argument. So I simply cited a professor at Harvard who has reported that microbacteria test positive for HIV. And the reaction was, what are you saying? What's that? And I said, well, the theory of AIDS demands that. And he said, you said the theory. She says the theory. And it was like I was being ridiculed for quoting a Harvard University professor. And I said, well, what it means is that anyone with TB would test positive. And therefore, they should not be given antiretroviral drugs. And that was almost like I was saying that there was no God in heaven, that I committed heresy. Everywhere I went in South Africa, there were adverts up saying, Sweet 16, HIV wants to sleep with you. Everywhere. Forcing governments to spend their money on antiretroviral drugs, not spending it on clean water supplies. Other scientists that was researching malaria found they were starved of money because all the money is going into AIDS. And any doctor worth their salt in Africa now who wants to get funding for their practice has to say that their patients have got AIDS, which is really easy if you define it so broadly. Any patient who wants money has to say they've got AIDS if they want money. The whole social welfare and medical system in Africa has been bent by this. It's just atrocious to see it. I mean, even in my practice where I go for my own personal doctor in England, the nurse I see is a former African specialist. She was out there in Africa, and she was telling me how she was absolutely starved of funds because she wasn't treating AIDS patients, she was treating malaria patients. And she couldn't get funding. And this is
there's another aspect to this as well. Look at every country in Africa. If Africa is infectious and it's sexually transmitted, then it should be everywhere. Why is it that in the more prosperous nations in Africa, you don't have the AIDS epidemic? You continue to see it where you have refugee camps, where you see poor people, where they don't have clean water, they don't have good nutrition. Yes. They're suffering from multiple parasitic infections. They have tuberculosis because they're in close proximity to other people in these camps. And yet they will use the numbers from a camp and so state that it represents a whole area. And it doesn't. And unfortunately, this is where the pharmaceutical interests have total control.